Hi, Martha. Thank you so much for being with us again today. It's lovely to have you with us, and I hope you're doing well.
Thank you. Yes, thanks for having me.
That's great. Martha, today we thought we'd talk a little more about why patients need to come to you, especially patients who have sexual dysfunction, couples who have issues in their sexual life following either spinal conditions or other conditions which can lead to sexual dysfunction, and the importance of your role, because we as surgeons understand that it's very important for patients to come to you, but I don't think patients in general understand how important your role is. So could you let us know more about this so that patients understand better and our viewers understand better why they need to look into trying and talking to people like you?
Most of the people who come and seek support for sexuality issues, challenges, concerns, they are usually in partnered relationships. And I guess it's less stressful and less pressing when you are not partnered. So often the ability to cope with conflict and challenges is different for different people. So what happens is my clients are usually of different personalities, opposites attract. So when a sexual problem happens and it is being brought up by their partner, a lot of times it is being ignored, it's being swept under the carpet. There may even be some psychological games such as deflecting, so as to bring attention away from the problem. For instance, oh yeah, I'm not having sex as often as you because you've gained weight. So then the partner thinks that the problem is them. But in reality, the person who made these kind of accusations are actually very confused and not willing to deal with this sex problem. So when it comes to the context of relationship, having a problem drag on for a long time and having all these kinds of lying to your partner can result in a lot of relationship distance, conflict, breakdown in communication. It could lead to the partner being on the verge of a separation or divorce. And I mean, when there's a problem and you're not ready to deal with it and you play psychological games with your partner, the problem doesn't stay as a sex problem anymore. You're actually doing psychological abuse. And so when you do that, so much so that the confidence of the person is being eroded, this damage can actually lead to further problems, such as, example, hate of man or hate of woman, even after the relationship ends, for instance. So I would say in a nutshell is when you are in a coupled relationship, the way you looked at it and the way your partner looks at it will be different. And your partner may be bringing up this problem in a very maybe not so tactful way, but really when it comes to talking about sex, I think sometimes we have meaning to deal with some subject. So I would suggest to people to not take it so personal as much as possible, even though it's very, very personal and private topic, and to seek help as soon as you can, because this can lead to a lot of relationship stress, breakdown, even possible risk of separation and divorce. So that's the couple part that I wanted to say. When it comes to individuals, whether you care about what's going on with your partner or not, the reality is that we often don't know what we don't know. And when you seek support from somebody who is trained, who is educated with the right credentials when it comes to dealing with sexuality issues, you are ensuring that you get the best quality of information and resources. And this will shorten your learning curve, so much so that you don't waste time groping in the dark and trying to solve the issue by yourself. And you pinpoint the exact issue and then you work on it, and then you can actually overcome it pretty quickly. There are lots of people that I've worked with, they did not know that there are people who specialize in sexuality like myself. And so they go around and seek medical advice because that's what they are taught and that's what they think to do. So they go to a gynae, they go to a urologist, they go to even a hormone doctor, they go to a nutritionist, a dietitian, they go to traditional Chinese medicine, acupressure, they go to all kinds of drug or medical or even alternative therapies to solve this issue. But they didn't know that there's somebody who actually specializes in sexuality. So when you go to different people, they have different specializations. And even gynaes and urologists, sometimes they don't have very specific solutions to that very specific problem, like for instance, premature ejaculation or erection difficulties or desensitized penis due to painful penetration. So all these different problems that they actually don't really know what to say. Sometimes they can make things worse because then it makes them feel very hopeless. So if you don't know that very narrow expertise, then it's good to just seek a different opinion from somebody who really specializes in this area. So there's a disclaimer that I like to make, which is that it's really important to check the credentials and training and testimonials from whoever it is that you're thinking of seeking help from, because depending on their training, what they're going to share, what the remedy is going to be very different. If you go to, say for instance, a tantrika may seem like a sex educator, but really their field of knowledge is only tantra. And tantra is a very ancient philosophy of living, and only a small part of tantra actually focuses on sexuality. And so a lot of tantra focuses on, say, only breathing, and a lot of tantra only focuses on accepting the moment and being present. And that is just one way of looking at dealing with sex problems. Whereas if you go to someone who is a sexologist like myself, we look at Western ways of dealing with sexual issues, such as sex therapy. We have had to learn a little bit about medicine. We have to learn about body-mind connection. So we also know about Tantra, we also know about body work. So when you go to somebody who has a wider field of knowledge, they are going to say something different. And so what's going to happen with people with Tantra training, depending also who they train with, how long they trained, they may not actually be able to solve that very specific sex problem. So I would have to say a lot of times while they go to sex experts, you have to look at their credentials. And unfortunately, it still is very much a hit or miss at the moment for a lot of people. And so if you go to bodies like, for instance, in America, ASEC, American Association of Sex Educators, Sex Counselors, and Sex Therapists, you're going to find that people have had much more training and much more rigidity in their training, and also the continuing education that they are required to go through to make sure that their knowledge is up to date. So I feel that these are some of the safeguards that someone can do.
Yeah. It's exactly for this reason, Martha, that we wanted to get you on board and we wanted to talk to you about it, because I think a lot of viewers, a lot of patients don't understand that sexologists don't just deal with one form of sex treatment, and they have a holistic approach. You'll know medicine, you'll understand the conditions, you'll understand the physiology behind it. And this is not easy, like as you said, when patients come to us as surgeons or as they go to gynecologists or urologists, they're just trying, as you said, groping in the dark, trying to find answers, but they don't, and eventually they give up because they don't really find what they're looking for, which is exactly why they need to come to sexologists like you with good credentials who understand the spinal conditions and all of that, so that they get exactly what they're looking for without having to waste time on it. And I think you would agree that patients will fare a lot better if they come to you faster, because it gives you more time, it gives you more ability to sort of get to the problem a lot faster than, you know, spending a lot of time. And I guess psychologically too, it makes a big difference. If they've tried so many things and then they come to you as a last resort, it's a big difference than if they come to you with full respect and full trust, saying, I think this is where my problem will get solved.
Yes. So it's very unfortunate that as much as we want people to seek help, also seek help from the right people. And yes, a lot of times clients come to me 2 years, 5 years after they have had this problem for a long time, and it really erodes on their well-being, their mental health, their self-confidence, to the point that they are so low on energy that they don't have the ability to do anything, because they just don't have any more fighting spirit inside them left. Something inside them has died. So when things drag on and they keep going to different people, like you say, it's not just that the problem has dragged on, is a lot of the other things are lost years, lost energy, and also breakdown in the relationship, which sometimes is beyond repair because the partner has already checked out. And so it's very important to seek help, because maybe you are the person who is having the problem, maybe not willing to face it, but actually just understanding, even if you are not willing to do anything at all at first, at least just find out more so that you understand, okay, this is what is possible, rather than wait until you are running on empty and then face it. Sometimes it's just too long, and then the partner is extremely frustrated and not willing to support, not willing to try anymore.
Martha, just another question which is a little off from what we're asking you, but still important. Where you practice, do surgeons or medical practitioners have the awareness to refer patients to you, or is this something you don't see very often?
Yes, so I'm very fortunate that I work very closely with the urologists in Singapore. The urologists and the andrologists, they have embraced me, and so I do get quite a number of referrals from them. And as for the gynaes, I also get referrals from gynae, but I would say less so, because a lot of times it's kind of like who you know. And I'm very fortunate. I get to speak at medical conferences in Singapore, so I have referrals from the doctors. But what is unfortunate sometimes is that people some people are not willing to refer clients because it means a loss of income. So I know of gynaes who try to treat patients with vaginismus, for instance. So vaginismus is a condition that happens when a person with a vagina tightens their vagina in anticipation of pain, making penetration very difficult or impossible. So it's more of a psychological, usually psychological fear of pain. So what the gynaes do is they try to support this person with whatever they know, and sometimes actually it makes things worse, because they're not patient with the patient, and also they are not trained to be very mindful of the way they communicate. And so the way I talk to my friends, I speak very wrong, speak with my clients, because when I'm with someone face to face, I get to sense a lot more what exactly they are going through. So I really find it challenging when I have had the occasions where I had to do phone consultations because the Skype didn't work and all that. So I find that the interaction is very important when it comes to dealing with individuals, needing to be very sensitive and really plugged into the client, which I don't feel that gynaes and urologists have had that training to really work with people's psyche.
And this is true, because this is why we needed to talk to you about this also, because as surgeons or as other medical practitioners, we don't have the time or the empathy to understand what patients actually need. And that was another reason why we thought it was important that it comes from you telling us why it's important, and people watching or our viewers understand that there is a particular person trained to help patients who have problems. And I think you've explained it really well to us as to what you do and how you can help. And I think as surgeons, we need to stop being snobbish and start referring more patients to sexologists like you so that we can have patients benefiting a lot more.
Yeah, I think everybody has a role, you know. I also send my clients to doctors for checkup because I want to rule out the physical aspects. And it's not really just about making more money. I think it's really about what is best for the client or patient.
Yeah, no, I think that's correct. And which is why I hope patients take a lot of input from what you've said. And I hope this really helps them understand a lot more about what you do and why it's important to come to you, Martha. Thank you so much for being with us, and I hope you have a good evening ahead.
Thank you.
Thank you.